Kai, are you here?
Yes, I am.
Perfect. We can't see you.
Yeah.
Yeah, now we can.
Yeah, now we
Perfect. Okay, now we can start. So this panel, we are going to talk about the PISA tool that we actually heard a bit about in the beginning. So what is PISA? So if suppose there is an infrastructure like healthcare, schools, road network, how do we know people have access to it? So it's when you talk about access, it's not just geographical access, right? You have other components like are they able to afford it and others, but the PISA tool is mostly focusing on geographical accessibility. Like are they having able to reach a hospital within 5 kilometers of travel distance? That can be a question. Or are they having access to a road at 2 kilometer walking distance? So these kind of questions are very challenging to calculate because data itself is sparse. Some data is available online like open source, but we need to really drill deeper to know how effective they are for decision making. What PISA tool does is it helps us create these kind of descriptive analytics and optimization, like where should new schools be placed? Where should new roads be built based on all these different data stack? And then try to give decision makers the ability to pick and choose based on optimized models. So this is what the toolkit does, and it's an open source toolkit that we have developed, and it's online in GitHub repository. We have a lot of contributors to it. We also have a lot of users. So today we'll hear from some of them in this panel. So we'll start with Kai Kaiser. He's a senior economist from the World Bank Group. So World Bank is one of the first teams to come up with this idea, and we jointly developed it for Timor-Leste to get started. And now Kai will give a brief overview of how PISA fits into a lot of other operations of World Bank and how it is being used as a decision-making tool. Over to you, Kai.
Great. Thanks, Pavati. Can you see my screen?
Yes.
Great. So thanks, Pavati. And again, I'm unfortunate I couldn't join you today. I was hoping to be there, but I'm actually in Armenia, which is actually one of the countries where with the ministry, the PISA tool has actually been applied for the road sector. So at least I can say to you that I'm nearer to an actual country level application here in Armenia. But let me maybe, sort of set this in the context, the institutional context in which we, are applying these tools, because I think it sort of says a lot, both in terms of the expectations of the technology, the optimization issues, the others, but really, how do we let these tools actually have an impact on decision-making and the kinds of investments that ultimately do? So for us at the bank, we throw it in acronyms, but it's sort of public investment and public asset management are really sort of two core functions in asset. And in infrastructure governance means transport, energy, water, ICT, a whole other sets of issues. And then increasingly also cross-cutting principles such as climate change, which is sort of an important part of looking at infrastructure these days. And within that, we have the public investment and the asset management, and really the positioning of the work of PISA, or the kinds of tools that PISA does, really comes from within that sort of domain area. And so we look carefully about both looking at the data ecosystems, but also the kind of decision space that is both desirable and feasible, because there are a lot of things that are quite desirable or potentially feasible from a technical point of view, but actually sort of to have them an impact, you need to sort of carefully think about them within a sort of data and decision-making ecosystem. So we like to think about this in terms of building awareness and catalyzing action, sort of country by country, right? So it's easy to sort of have a technology solution, but if you cannot think through what your theory of change is, from sort of building awareness to catalyzing action, even the best technology will not have an impact. So I think the approach that we've taken here at the bank and in the work with PISA and ABW is really to think about data-driven decision support kind of at multiple levels. One is sort of thinking about country benchmarking more generally. The bank, of course, tends to work in lower income countries and middle income countries, But typically that kind of benchmarking that you'll see, kind of think about the Rosalind, the sort of typical SDG benchmarking, that's really at the country level. Now, what's exciting about this kind of work in terms of the geospatial analytics and the PISA work is that you can actually engage in deeper dives within countries. So this is really moving to the right, and the platforms that we've established, including the PISA, really are meant to move beyond the country indicators, unpack them, and begin understanding service access, not from X% of the total population, but really where, how, and can I improve it? In terms of the decision-making process, we think about it from a people, process, technology. And it's very important to sort of set the kind of decision-making tool, including the open source and the open data, within different contexts. And we generally think about contexts being nascent, emerging, and advanced. Now, what do I mean with that? The first is you could have countries where there's absolutely no data, no rudimentary government data on state non-financial assets. So, for example, the government has no data set on its own road system. So you effectively depend on OpenStreetMaps and global population maps to make some decisions. And it has really no limited strategic asset management policies in place. It doesn't really understand what road access is. So in that country, what you're really trying to do is move the distribution to the right to get them to think more in a data-informed way. And I think the power of the kind of tools, the PISA and others that will be presented today, is the global data provides us that ability to move that distribution to the right. But I think where the real key comes in is then beginning to understand how can you actually, in countries that have partial data, begin actually crowding in government data? Because it's a lot more credible to say, what is your public services, infrastructure services access using the government's own data, or showing the government how it needs to improve its data after you've shown the initial PISA reforms. Now, I'll conclude very quickly, but to say that what we've now done is established an initial, for launch later this year, a pimpam.net stack. And that stack, I think, for our use base, comes with the Digital Government Academy. So it tries to explain why, what, how, basically explaining why would you as a government or as a public sector apply tools such as PISA. And more importantly, then begin offering those tools as an open source sort of set of stacks. So the public infrastructure services access tools that you'll talk about today, or others that have been deployed, sit in a broader stack of the public geospatial planning and budgeting platform tools, along with a set of other tools like the climate change screening tool, the green economy tool, which looks at using night lights and other technologies to look at and air quality, to look at development subnational levels, and then more detailed tools such as cost-benefit analysis tools. So the PISA tool, in terms of beginning to unpack that first level of awareness, really sits in an integrated stack that explains to policymakers where it sits. I'll sort of won't go into this, but just to say that when you deal with countries, you quickly can also unpack the technology. So typically where we operate here is in the emerging country, Kansas, where you're trying to promote basic asset registries, including after a disaster, and using that information, to very advanced settings that are using more advanced technology, including digital twins and others. But the key message here would be, it's really important to set things like PISA within this country spectrum to sort of understand where it would resonate, either moving the countries to the right, or beginning to build innovations such as integrating artificial intelligence or use of satellite data. So let me just conclude, I think, with a kind of a headliner to say what we're trying to do is to actually situate tools like PISA in a wider debate about public investment and asset management and peer learning. As you get more countries to adopt it, that's a lot more powerful than the providers of the tools. And then allowing people, these peer networks, to have these on-type tools that are able to sort of provide these services. And I think this is where a lot of the tools in a sort of common platform come in. Now, I won't speak about the sort of the actual functionality of PISA, but hopefully what you've understood from my talk is that when you have these technologies and data, they do need to be put in an institutional context of a country, and seeing how you can leverage those technologies to kind of move things over to the right, as opposed to be a sort of freestanding technological solution. So thanks very much, and I'll leave you with a picture of the real PISA. Over to you.
Thank Thank you so much, Kai, for setting this scene. So just to summarize what we take into consideration when designing any program with PISA in a country setting is to look at what level of maturity the country is. So for example, if the country don't even have road asset systems where roads are mapped and OSM itself is not having a lot of information, you cannot really start with the optimization model, but you have to start collecting data. So World Bank then invests more time and effort in that space rather than directly applying optimization. And this is also where PISA plays a role, because we look at OSM and we look at the existing data to see, is it actually good enough to start with the optimization. So PISA is not just an optimization tool, but it also helps in data quick scans and data pre-processing and also data descriptive analytics. So that's where we usually start and then slowly move towards optimization. Next, we will hear from Britt and Maria on one of the applications of PISA. And over to you, Britt.
Yeah, I think Maria kicks us off today.
Okay, go ahead.
Yeah, I think a short introduction of myself. So I'm Maria, I work at 510. Maybe also nice to mention, I joined the Fellowship of Analytics for a Better World in first cohort, which was very fun and inspiring. I won't bore you with any more details on the work that 510 does, because I think you already heard that from my colleague Wessel. Does this? Yeah, great. Okay, just skipping it. So I wanted to tell you a little bit about the project that I'm working on, in which we use PISA. So the implementation area here is West Darfur, which is a state in the western part of Sudan. It consists of 8 different localities, and they all are dealing with a lot of challenges. And one of them, or a big one, is the shortage on drinking water. Not only is there a shortage on water, but there's also during the wet seasons, it's very hard to retain that water as well due to quick evaporation. Moreover, there's limited funding resources to drill additional boreholes to serve people with drinkable water. So in this project, we did receive a small fund to actually drill additional boreholes, but because of this limited funds, it's very necessary, it's very important to actually find the most optimal locations for these boreholes. So the main objective of using the PISA tool was identifying the areas in West Darfur that are most suitable for borehole sampling, considering the amount of people that live there, to understand which locations to actually prioritize for sampling in preparation for borehole drilling. And of course, when drilling boreholes, you need to take into account some standards, most importantly, the SPHERE standards. So these are a set of humanitarian standards in technical areas such as water and sanitation. And the 2 most important ones that we really wanted to take into account is the first one, a borehole should be within 500 meters of a home, of a person, in order to consider that person as having access to that borehole. And second, there's a capacity limit. So a borehole can only serve up to 500 people. And when using a PISA or an optimization tool, you also need to set some objectives. And our objective here was a coverage of 50% in every locality. So in other words, we aim for 50% of the people in each locality having access to a borehole, and also considering the already existing water points in that area. Let me see. So if we're talking about access, so I talked about a distance of maximum distance of 500 meters. There are also other factors that you can possibly take into account when you're talking about if people have access, yes or no. For example, rivers and roads that can block the way of people getting to a borehole, but also elevation can really limit mobility of people. Important to mention, these are factors that are still up for discussion. So we still need to figure out whether it's useful to actually take these into account as well, but it's definitely possible. And before Britt is going to talk a little bit more about the technical details, I first wanted to already mention some key learnings from my side. It was great using the tool, and I think it has a potential to make humanitarian project like this one way more efficient. And in this situation, it really provides a sample, an initial sample of possible promising locations for boreholes, because as you can imagine, there are a lot of locations that you could consider when drilling additional boreholes. Still, it's very important to always take into account the input from local stakeholders. This is something we always strive to do within our projects, to really talk to the people on the ground who actually know the area there. For example, if you have found an optimal location for a borehole, you still need to take into account whether it's actually safe to drill that borehole for the workers there, but also for communities, whether they can actually travel or go that distance to the borehole. Because as we all know, in Sudan, there's a lot of armed conflict, so it cannot even be safe for people to access those boreholes. Also, the distribution across the area for new boreholes. Because, for example, if there was already a borehole drilled in the year previously in a certain community, then the Sudanese Red Crescent might want to shift focus to another community first. And also, of course, it's very important to also take into account hydrological research, whether it's actually feasible to drill those boreholes. So I think these are the main takeaways that I wanted to mention. And then on to Britt.
Yes. So, hello, I'm Britt. I'm a mathematician and I'm currently doing my PhD within Analytics for a Better World. And I will take you to the nerdy stuff of this presentation. So first, let me explain to you the facility location problem very simplistically. So as you can see here, we have West Darfur. And we have the population spread all over the country. And the question arises, where should we locate new boreholes? Then we look at all the possible new locations shown here as the white triangles. And then we look at how much of the population has access to these boreholes within a 500 meter range. Then doing a lot of interesting mathsy stuff, you can find which boreholes to choose if you only have a limited amount to choose. But I won't go into that too much today. What do we need to do such a project? The data we are looking for is the distribution of the population, as shown here. So all the blue dots are population points. And these population points are on a grid. So every population point is at least 80 meters away from the other population point. And every population point has a number of people it accounts for. So here, just exemplary, one can be 18 people, one can be 13 people, one can be 8 people. And just to specify, this is data from WorldFog. All right, and here you can see how much population is accounted for in each population point. I'm moving on. The next data you need is where the current boreholes are. And this data we got from the Red Cross. And as you can see here, they very much center around the middle of the country. But we will get into some challenges with this data later. The last data you need is the topographic data. So as we just talked about, we want localities to all have at least a 50% coverage. So you do need to know where the localities are. All right, so now there are a lot of challenges when trying to find solutions. And the first challenge is that this problem can be computationally quite heavy. So if you look at all the possible new locations, not taking into account yet where good drilling points are because you want to filter them out, but you make a grid and you locate these boreholes or these possible new places for boreholes 80 meters apart. And here we see a tiny little part of West Darfur because I kind of wanted to show how many points that actually is. So this is this tiny little bottom part, the green one, I forgot what the name is exactly. It's difficult. Anyhow, here you see an 80 by 80 meter grid, and it's in this small little part already almost barely visible how many points this can actually be. And for the entire country, this is almost 3.5 million boreholes, possible locations. And if we move on to a larger grid of 200 meters by 200 meters, you can already see it's less crowded. And still we are left with more than 350,000 possible locations in all of Darfur. And another challenge into complexity is the large population size, because for this problem we have almost 900,000 population points, and we want to assign every single one to a borehole with it. And one solution we have already found is clustering these population points together to cut the solution into smaller parts. And we look at how proximate these population points are, because if two population points are within a kilometer radius of each other, then they can be assigned to the same borehole, but they're further apart than that, they won't be assigned to the same borehole. And that's how we cluster these. Another challenge is accounting for 500 people per borehole, because first of all, you really wonder, where do I assign these people properly? And also you need to take, you need to save to your computer where these people are assigned. And that brings a lot of complexity along with it. And also you might leave people out that need to be assigned, that can't be assigned anywhere else. All right, another challenge is that the data quality is quite bad. When we look at the current the current boreholes, we see that they have a locality assigned to them, but this locality often doesn't correspond with its location. So as you can see here, we have all the different localities and we have these little points. Those are the water pots. And I've labeled them according to locality, and especially in the part that is enlarged here, you see all these different colors of localities, all within this one locality of Elmina. So that is quite a challenge, because how are you going to take these boreholes into account if you do want to take them into account, but you don't know where they are exactly. This is new or not, how to incorporate get good data, make sure it's less attractive, but not to skip it. I'm not sure, did I add this in? I'm a little confused, I'm sorry. But anyways, this is our presentation. Thank you for listening.
So much, Mariah and Fred. So in this particular presentation, you saw one sample of PISA, one variation of PISA that is being implemented. So a similar approach have been done, for example, for COVID lab optimization in Nepal, together with World Health Organization, thanks to the amazing work by Professor Joachim. We also have implemented stroke care accessibility in Vietnam, and also healthcare accessibility in Timor-Leste with World Bank, and Kai also mentioned a bit about Armenia. So all of this have been done with different variations of data and stack, similar to what was explained now. But PISA also have the flexibility to have different variations. So what if the infrastructure is not fixed, but it's moving? For example, a mobile clinic, because that's also quite critical for developing country context, especially for rural accessibility. Maybe it's not always financially viable to have a fixed infrastructure, but maybe they need to have, especially in remote villages, they need to have recurrent revisits of mobile clinics, but also centers for training programs. So there is a lot of demand for mobile infrastructure. So now we'll hear from Kitava and Mayuk on one such use case and a different variation of PISA. And Kitava is from Amref Health, one of our initial, from our beginning, one of our core partners. So over to you, Mayuk.
So I think also Kitava will start.
I will share.
Thanks, Mayuk, and thanks, Parvati. So we've been working on this for the past 1 year with the team at Analytics for a Better World. And I think COVID really made us realize as in Kenya, especially, and the wider sub-Saharan Africa, that many Africans were willing to pick having a meal before picking a vaccine, just because, for instance, in Kenya, the healthcare system is from a level 1 to a level 6 hospital. And what that means is the level 1, 2, and 3 at the village level, all the way to the district level, might not have had a vaccine. So the people had to actually go to a level 4 or 5, which is actually further from where they live. So the ideal scenario would be that a level 1 or 2 should be able to have the vaccine for them, but they had to go further. And more often than not, they would pick having to buy food instead of paying for transport to go get a vaccine. So AMREF decided to come up with the solar-powered mobile clinics to just improve the healthcare coverage and vaccination coverage for Kenya, and now it's being implemented across other countries in sub-Saharan Africa. And so the goal is being able to use data to help us understand how best we should be able to route the mobile clinics, being able to look at the population that we are serving, being able to look at the health worker to population ratio, being able to look at the type of healthcare unit that is there. Is it a level 4, 5, or 3, so that we can actually be more efficient in how we are distributing personnel, healthcare commodities for people at the last mile. So I'm gonna hand this over back to Mayuk to just share a little bit more on the tech. But what I love about this picture is the person at the back with the coat, that's one of our AMREF staff. But the mobile clinic is so exciting for people who are at the rural setup here in Kenya, that this was one of the market vendors who took over the mobilization of the clinic, calling out people to come and get vaccinated, get their blood pressure checked, just because they felt more ownership being able to see a mobile clinic right there next to where they were selling their wares in the market. So over to you, Mayuk.
Thank you, Kitawa. So from where Kitawa left off, so the aim of this project, when I started talking to them, is we want to come up with a routing for the mobile clinic in which order to visit specific sub-counties and how to vaccinate there, right? But like since COVID is hopefully going away, you have also said that, so they want to extend the scope of this project, not just for COVID vaccination, but also for other non-communicable diseases, maybe for diabetes treatment or pre and postnatal care, right? And maybe even for generic public health care. So the ones and twos that you see is just a label of what like type of analytics that we can bring into. For example, in public health, one idea would be to also incorporate predictive analytics to predict the need for public health in different regions and then do the optimal routing for the clinics, right? But for the rest of this presentation, we'll only focus on the COVID vaccination case because that's what we're currently working on. Okay, so the framework, again, since we have been talking about optimization, so what we need to do is find an optimal route. But then in terms of what? So what we want to do is, of course, minimize the travel cost of these mobile clinics because it's really costly. But also what we want to do is maximize the vaccine coverage, right? That is, we want to get our mobile clinics to those populations where they don't have access to the vaccinations and we can vaccinate as many people as possible. But then there can be a question that per day, the mobile clinic can vaccinate a fixed amount of people, right? But then how do we actually take into account this coverage part? But that comes into the picture because accessibility varies. So for example, from sub-county A to sub-county B, there can be in sub-county A lot of level 4 and level 5 vaccination centers, which the people can already go to, right? But there can be in sub-county B very less of these level 4 and level 5s. And so we need to have more days there for the mobile clinic to vaccinate more people. Also, what varies is the willingness of people. Like we have seen through data that there are cases where there's a lot of these level 4 and level 5 centers, but the vaccination numbers are not that high, the percentage of population, right? So what do? We use data to try and come up with an optimal route. And what are the data that we use? So again, as everybody has already done, so we use GEATM for the administrative boundaries and the WorldPop for getting population data. And we use OpenStreetMaps whenever possible, or Mapbox and Google Maps API, because there are certain situations when we don't have enough information in these open source tools, right? And we get some data from the Kenya administration. So right now we are focusing on 3 sub-counties because AMREF has a tie with them, and we can get the actual data from the government of how many people are being vaccinated, where are these facilities located, right? So, but before that, we need to come up with a measure of accessibility, or like try to define how we look at accessibility. So in this case, we already use some capabilities that has been developed in the PISA for other cases, as Parvati was mentioning. What we do is we look at the level 4 and level 5 healthcare centers, which can provide vaccinations. And then we have taken a 2.5 kilometer walking radius around it based on Mapbox, and try to calculate how many people fall within each of these radius, right? And how we come up with this 2.5 is actually, initially I started with 5, but then upon discussions with the people in AMREF, we decided that 2.5 is the way to go, because in Kenya, people are hesitant to go to a facility which is more than 30 minutes away by walking distance. So that's what we do. And then for each sub-county, we just aggregate this information to come up with a score, which shows the accessibility of each sub-county. For the willingness, we actually have vaccination numbers for these regions and try to see what's the percentage of population that has been vaccinated, and try to come up with, again, another measure which we will use in the optimization, right? So in the next few slides, what we will do is I will just show you a little graphics on these things that we actually have calculated. For this project, we are actually in the process of making the optimization tool, and we are trying out different strategies and comparing them, and hopefully soon we'll be able to implement them. The good part is, like with AMREF, what I found out, they're really willing to implement this as soon as possible, and they are saying, give us the model as soon as you can because we want to try it. So that's a very good thing, which we don't see generally even in businesses, right? So coming back to the data, so this just shows the discrepancy in the number of healthcare units across the 3 counties, right? So as you can see, Kisii has a lot of more healthcare units, like which are level 4 or 5, that is, which can vaccinate people for COVID. And if you look at the population, you will see that the population of Kisii and population of Narok are very close, but the difference between the number of healthcare units is like more than 2 times, almost 3 times. And here I just wanted to show, like, for example, there is one particular sub-county in Kisii which has 17 level 4 and level 5 health centers that can vaccinate people, which is more than what you can have in total in, say, Narok or Nyamira. So there is a huge discrepancy between the counties and also the sub-counties. That's why we need to look into accessibility. And in this picture, so the red dots show the location of these level 4 and level 5 health centers. And on top left, what you see is there's a very dense distribution of these like health centers. And that is also the region where we see that most people have been vaccinated, or the highest percentage of people that has been vaccinated. But again, it's not linear or entirely correlated, in the sense that wherever there is the highest number of health centers, it's not that the vaccination rate is higher there. So the willingness is also something that we need to take into account in the ground as well, because they are working there constantly. So what they have figured out, the people in AMREF, is that people are only willing to take it when they already have any other diseases, which can be riskier, but otherwise people are hesitant to take these vaccines, right? And this shows the population distribution across the sub-counties, and also like the total amount of population in each sub-county that has access, like walking access to these level 4 and level 5 health centers. As you can see, there is only one sub-county marked in dark green in the graph below, which actually has decent access. Otherwise, it's very less. And for example, there is a sub-county, I think in Narok, which actually has no, if you see like on top, there is one sub-county where there is no red dot. That means there is no level 4 or level 5 health center in the entire sub-county. So the people in that sub-county cannot take a vaccine in their sub-county. They have to go travel to another place to get the vaccine, right? So these are the data that we are using as input. And now what we are doing is trying to use these to come up with an optimization model. But what is the next step after the model is something Kitawa will take you through in this next.
Thanks, Mayuk. And I think most importantly about this particular project or program that we are doing is being able to inform governments on areas where they could actually upgrade level 2 and 3 health facilities to become 4, where other people can get, a level 4 is like where you can get surgical support, you can get, higher elevated tertiary health services. And at the moment, you are able to see that the level 4, 5 hospitals are not equitably distributed against what the disease burden looks like. So we are looking at our mobile clinic as a data engine, as an insight generator for government to actually understand what the disease burden is in different counties against the population, and also the distribution of health facilities. The other thing that we are also able to see is, for instance, you find there's counties in Kenya that perhaps have malaria, but there's other counties that maybe have higher prevalence of diabetes. So the goal is to be able to use our mobile clinics to begin to build a map of what the disease burden looks like across Kenya and later across sub-Saharan Africa. AMREF has a presence in over almost across the whole continent of Africa. We have physical offices in over 13 countries. We have partners in about 44 out of 45 countries in Africa. So we see an opportunity for our mobile clinics to be engines to actually collect this data, and using these tools should be able to support us in supporting that. And of course, when we talked about willingness, the goal is to be able to continue to equip our community health workers who are learning through existing digital tools that we have at AMREF. So we have one learning mobile learning tool that's called LEAP, where the community health worker learns the health curriculum from their mobile phone, whether it's a smartphone or a feature phone. And the goal is to be able to track their learning and incentivize them to refer people to the clinic and to the level 4 and 5 hospitals that are in existence, so that we can have more people actually receiving help. So this being able to give them vouchers that they can redeem and on their day-to-day life through, say, buying credits for their agricultural work, because a community health worker is a volunteer. So how can we also use this data to improve their well-being as community health workers in their day-to-day life? I know the second one is cut off, but I just tried to explain it as best as I could. We can go to the next slide. I think the next slide is just pictures of what our clinic has been able to do. You see elderly people who are not able to reach hospitals coming, those who have disabilities are actually coming to receive care. As you can see here, we were doing tuberculosis screening. So the willingness to actually come to the mobile clinic is higher than the willingness to go to a hospital, because they know they receive care at their doorstep. And I think the next one, yeah, this is just the demand. When we are at the clinic, you'll be able to see when we're running medical camps, we cannot actually manage the numbers. We have over 300 people coming daily for this one mobile clinic. We already have a fleet of 10 mobile clinics in AMREF, and we are partnering with governments to be able to get them to, partner with us to reach further and further areas across Kenya. So the end goal for us is to be able to have last mile as a service, not only for health, but for also other industries that are there that might need to use this data to support people at the last mile. Thank you so much. Over to you, Parvati.
Thank you so much, Kitawa and Manu. So you have seen how complicated these data sets are itself, but also the analytics part can get quite tricky, because First, we started with Timor-Leste, a small country, but then we had to do Vietnam, and the same code took 48 hours, and then we had to switch to an entirely different optimization model and others. So this requires not just data analytics skills, but also research into specific optimization models. And this is where we have an amazing research community that is being set up by Prof. Stick. He's going to tell a bit more about that in the next session.
Yeah, I think I don't need that.
You don't need that, yeah.
Yeah, so in fact, we've seen many applications. And so what we're doing now is also developing a toolkit, which can be used for generic applications. The toolkit is called PISA. And up to now, we do it together with people from our own university, Joachim, I see there, but also from Tilburg University and students. But more and more we see new problems arising, new applications for which we cannot use the toolbox. So we have to extend it, we have to invent and to develop new methods. And for that, I realized that the last months, many colleagues also in other countries are really interested to contribute. Several of them are also here. And so the idea is to set up a research community to work on these type of problems. So if you're interested and you are a researcher, and if you're interested also to join, please contact me. So the idea is that soon I will give a presentation about what is needed from an APW point of view. And then I try to seduce you to work on those problems that are also useful in practice. And then afterwards, if something useful comes out of the research, we will incorporate it in the toolbox and then also use it for applications. Or if you want to go further and also would like to connect to the real application already directly, that's also possible. And then we can contact you with the direct application. So that's the idea. So one of the research that has already shown interest, being interested in that is Helena Ramalhino Lorenzo, if I pronounce it correctly. So she already is working in this type of area, a long time, and also already did many applications like we have seen before. So I'm really very glad, Helena, that you are interested in this research. I would like to join. And also glad that you are willing now to share what you've done in the past already in this respect. So may I give the floor to you?
Okay, thank you so much. I hope you hear me correctly. I am really sorry that I'm not there since my new job or my new position at the university. I have to be in the meeting of all vice presidents of international in Spain. So I'm in Leon now in Spain, not in Barcelona. But it's a great pleasure to be a member of this fantastic team. So we are really happy. And I must say that the work we are doing at the research group at the Universitat Pompeu Fabra in Barcelona is a collaborative work. So I see Jessica de Armas is online. I know Isabel Gomez is there physically present on the room, and also some colleagues from UPF, some colleagues from Portugal, and some colleagues from Brazil and South Africa that we are working on developing new research areas in this topic. I'm just going to mention two that we have done. One of them is with Jessica de Armas, which is online, and Marta Reinald, which is an economist, and she worked for the World Bank for many, many years. And with Marta, she's an economist, and it was very interesting to work with her because we have, Jessica and I have operation research background. She's an economist. So it was very interesting to collaborate, and we did work for locating schools in Mexico, in an area where the population was growing 1,000%. The objective here was not to propose a final decision, but to show to the policymakers what was the impact of locating schools on the walking distance for the children. So we could have some studies and say, okay, so if you locate this number of schools with this budget, you will take 1 hour to school in average for the children. If you locate more, you take half an hour. So it's more than like assessing the relationship between locating schools and the budget and the walking distance for the children, and help the decision maker, the policy maker, to have a better view what was the impact of their decisions. So this is a project that we were very proud of, because it was a collaboration between developing economists and operation researchers like Jessica and myself. This is published. Another one that I want to briefly mention is in Barcelona, is for locating a service for what we call assistive technology. So assistive technology are equipment like a wheelchair for people who has difficulties in mobility, and this is like a circular economy. So they collect this technology, they repair them, fix them, and then they give them, they lend it to the people, and avoid this to go to the garbage and buy again, like for example wheelchair. So this is an interesting project, and we know that if the stores are close by to the population, they will return better. They will return more. So we help them on locating this, like collecting points in Barcelona. And this is also published. So we are working on these location problems to help to assess better the services. We have some more that I don't have time. I don't want to take your time to explain. But the message here is there's a great opportunity for research in this area. Even location is well done, well studied. It's like a very established area in operation research or analytics, because the factors can be different. We don't look only to the cost, we don't look to the price, but we have to look to the social impact. What is the social impact? And we can help to make this relationship between a budget and the social impact. So here we have a different, let's say, objective function. We have challenge on data. You mentioned briefly the previous data challenges, which is important. How do we deal with these challenges? And as I said, finally, someone has to make a decision. So this decision be made. So I think we can all together help to make a better decision with advanced research. So there's a research opportunity. And I must say, in Barcelona, we are very happy because the government of Barcelona, the government of Catalonia, and also the government, the city council, is really interested in these projects. And the projects that we initiate with the city council, now probably we're going to elevate it to the government of Catalonia, because they really are looking for analytics to help them to make better decisions. So there is an opportunity on research with a good impact, and this is a great satisfaction for all the team. Thank you so much. It's a great opportunity to be here.
So much, Helena, and it's really great to see the global community coming together, and not just we are a group of researchers working in Netherlands, and but we have a lot of more traction coming in this direction, which is great. So we have the research. Now we also have great nonprofits providing us with use cases. But there is one thing missing, which is how do you actually make the research actionable, create software or tools which are scalable, replicable, and can be reused easily. So every time a new use case comes, you don't need to start from zero, but you have a well-documented stack. And this is where our industry partners like DHLs of the world, and we today have Lutz here. He's going to give a brief intro into how we are trying to make PISA scalable and replicable. Thanks. Over to you, Lutz.
All right. Yeah. So first, I wanted to give a brief introduction also that the ESGs are not anything new at DHL. So we have multiple established group-wide initiatives committed to doing good. My favorite example is the first. It's the Go Help initiative, where we have the disaster response teams. They are flying in to the airports in disaster-struck regions and organizing logistics. They do that together with the UN and the World Food Programme. And they also have a program, Get Airports Ready for Disaster, which travels to airports and works with the local agencies to make them a bit more prepared when disaster strikes. And we also have Go Teach. They mainly work with the SOS Children's Village helping people to transition from working life, giving workshops, and yeah, helping young people. The last one, Go Green, of course. We have a huge fleet of planes. Actually, in 2020, when all the passenger airlines were grounded due to the pandemic, the DHL Express fleet was one of the largest still operating fleets. So we need to get them to be sustainable. So we are buying sustainable aviation fuel for those, electrifying our delivery fleets, investing in clean energy projects. So yeah, and we are the DHL data analytics team. We want to also do something good. So that's why we are working with APW. So who we are, it's 130 plus data scientists worldwide. We have so many use cases. If you want to hear more about them, talk to me. And yeah, so we have gathered some technical expertise in the last decade. And so I try to get the essentials out of it for PISA. So what we want to do is we want to share the code, right? And to share code, we need to have permissive licensing. All right, this is of course our own licensing. And I guess we have complete control over that. But we will also use probably third-party code packages, and then we need to check that, right? The licensing needs to work for us. Ideally, we use technology that a lot of other people learn or use, right? And we are currently in the Python ecosystem, and that is one of the largest in the world. So there's a lot of people who know that, and it's also very valuable to learn it. Now, we want others to use the code, right? In research projects, in projects from NGOs, documentation. It's not very high tech, right? But good documentation makes the code actually usable for others. Coding standards. We have a lot of people coding, hopefully. We want to be open to submissions by others. So we need to keep in check that the coding is good enough. Reproducibility. Now we can talk long and broad about the difficulties of making Python run. The typical, it works on my machine issues that can happen, right? There are techniques and ways to get these problems under control. Then we have heard so many very different use cases here. So how we name stuff in the code, we need to be as general as can be, but also expressive, right? You look at the code, the coders, and then they see, yes, this is what I need, because if we name it mobile clinic locations, then maybe the borehole locations, they might be unsure. Can I use this in the code? Is this the same for my use case? And then, right, we want to add a lot of algorithms and different things. You need to be modular, and that needs some careful considerations. Now we want also others to add to the code, be it students, be it people who just stumble upon it on GitHub, right? So we do need a version control system. We need code contribution rules, right? What do you need to do so that your pull request, that's kind of what you do as a programmer. I have a good change, here is a pull request. What do I need to do that you will accept it, that you will merge my code into the code base? And then a lot of super technical things. Again, if you are unaware of these and want to know more, talk to me. Unit tests, end-to-end tests, linters, just some keywords. And then at the end, if we have contributions, we should celebrate them. We should engage with the community. Let's and scale and grow this great project.
It actually sounds, when you put it like that on slide, it sounds very simple, but when we work on it, this is not simple and not something that a lot of people, data scientists and others don't give a lot of attention to, but we want to make sure that this is adhered to so that it can be reused. Otherwise, it actually is not that easy to replicate and scale across use cases or for other countries. Now, with this, actually, we come to the conclusion for this panel, where we hope we have given you a taste of PISA. This is a toolbox that we are actively working on in GitHub. So we welcome collaborations from outside, open source community, from nonprofits who would like to develop use cases. So we are always looking for more collaborations to scale it. We are also looking to make more applications. So like Professor said, we are setting up the research community. We have Lutz team and others who are also supporting on making it modular and into a software. So we are always open for collaborations. Actually, we have to have a Q&A, but unfortunately, we are running a bit late in this panel. So please reach out to us during the networking time if you have any questions, and the questions in the Q&A, I will answer it after discussing with the panelists. Apologies that we couldn't do Q&A, but thank you so much to all of the panelists, and thank you all so much. And we now have another panel. So if you are interested to know more about the Academy, it's upstairs. The other panel is going to happen here. Thanks. And thank you also